Education, Finance, and Policy Committee will come to order. It's Monday for April 26, 2021. It's 9:30. And today we are going to have an informational hearing about some more challenging issues. The State High School League, MDH, some testifiers here to discuss some of the rules and guidelines around our kids' sporting events and that process. Was brought to Senator Housley is going to have a few words after my intro. She'll kind of give the overview of how this started, but it's essentially been an ongoing challenge since the school year has begun. The districts managing COVID issues via MDH in the state, and then not only for the entire school and the classes, but also how they manage sporting events. And we have heard through the school year some challenges and issues and problems, whether it's track or hockey or basketball, that have accompanied our kids in their sporting events. So this latest issue, it's really bipartisan, because I know that constituents have contacted members from both sides of the aisle about their frustrations and the desire to get some clarity to this issue and understand what's happening and how it's supposed to happen. Again, Senator Housley will lay out a couple of questions and issues. So it's a bipartisan issue. There don't seem to be uniform standards across the board for all schools to apply to all schools. In the end, this is unfair to the students and the athletes, and certainly can end up being harmful to them as well. There was an example just recently, yesterday, later afternoon, I heard there was a girls' soccer game scheduled, and one team was advised they had to wear masks outside the entire event. The other team was told they didn't. So you had one team literally running around in masks on a field playing soccer. The other team was not. So anybody with common sense would understand that there's a lot of problems here and it didn't make any sense. I'm not pointing fingers at anybody, but there are problems here and our kids are paying the price. So we've also invited Senator Benson and Senator Draheim to this hearing as well. So that will conclude my comments. We'll have a couple of comments at the end, but I will turn it over to Senator Housley to give a little bit more of an overview, and then we're going to go to here's how it's going to go. We're going to go to Senator Housley, some parent testifiers, and then the MDH Commissioner Jan Malcolm, and finally the High School League Executive Director, Eric Martins. I believe our CA, Greg Marcus, has explained the time limits and the ground rules as we go forward. So please adhere to that. We have an hour and a half, and we got to hopefully stick to that. All right, with that, we turn it over to Senator Housley. So go ahead, Senator Housley, with your intro. Follow the rules, Senator Housley. Follow the rules.
Follow the rules. Stay in my time limit. Thank you, Mr. Chair. And honestly, thank you so much for having this hearing, because it's so very important to the kids and the parents and the schools throughout the state to get some answers that they've been desperately waiting for this whole sporting season. Today in this committee, you're going to hear stories about the heartbreak of kids and families throughout the state and how their dreams were crushed when they weren't allowed to compete in the state tournament because of a possible COVID exposure. This is across the state, from Hermantown to Hill Murray, Lakeville, Edina, Mankato, and across all sports, like you said. And these parents and these families and schools, we and me and you, we want to know who's making these decisions. Was it the Minnesota State High School League? Was it the Sports Medicine Advisory Committee? Was it MDH? Was MDH giving guidelines to the State High School League, or State High School League making their own rules? How did they come to these conclusions? And were there absolutely no exceptions? Like, could they look at each case by case, or was it just a blanket ruling and that's the way it was going to be? Some of these families and schools went to extremes to try and get answers, even filing a lawsuit to be able to play, but the answers didn't come quick enough, and these schools did not be able to play in the state tournament like they wanted to. You're going to see, if you look online where the agenda is, there's a lot of letters and news stories and emails from athletes and parents and coaches how these decisions have affected these kids for the rest of their life. And we got many, many more, but there were too many to post. We got tons of them here, and it may not seem like a big deal to some, but it really, really is a big deal to these kids and these families to have something that big that you've worked your whole athletic career, 8th grade to 12th grade, be canceled and not have the reasons behind it make any sense or no logic to it. So this hearing is for these families and these schools and these kids to just get some answers. Who was making these decisions? Was it the governor? Was it MDH? Was it State High School League? And just to try and make some sense of it all. So thank you very much, Mr. Chair, from all of these families and schools across the state. We really appreciate it.
Thank you,
And now-
Senator Housley. And I'll just mention too, we might have time, depending on how this goes, for Senator Benson and Draine to say a few words, but we're going to go ahead with the agenda right now. And the first testifier, I'll list off first, second, and third. Don Gillum is up first, and Bob Kaufman, and then Carson Diekman. Gillum, Hoffman, Diekman. So Don Gillum, you're up. Welcome to the committee. Please state your name and who you're with for the record.
Great. Thank you, Mr. Chairman and members of the committee. Thanks so much for allowing me to testify today. My name is Don Gilman. I am the founder and executive director of Let Them Play MN. Let Them Play is a bipartisan grassroots organization that started out when some moms and dads and kids thought it was very unfair that Minnesota canceled football and volleyball in the fall. A lawsuit last September showed that our governor had pushed the high school league to cancel sports. They deemed one, greater risk than others. And all of a sudden we find out there's no football and volleyball. So through a lawsuit and Let Them Play's public demonstrations, our great media for covering things, we were able to get football and volleyball back, on which was super incredible and amazing for our kids in Minnesota. So we continued our efforts. When championships were canceled, teams were unfairly quarantined with no spread happening, even though we had a safe fall ball season. Then in late November, Governor Walz shut down sports unexpectedly again, right before championships. We knew at this time there was no reason for it. So now we want to know what the real story is. And then our lawyers, since they'd been working on that lawsuit back in November, found out that the Minnesota Department of Health's own data showed that along with kids who played sports and didn't play sports, the ones that played sports got COVID at a much lower rate than kids who don't play sports because it's monitored. And again, there's physical activity happening, immune boosting is happening. They're getting proper sleep, and they're safer together playing and doing activities than not. MDH, their data also showed that during October and November, when cases were rising everywhere, the rate of COVID cases, the growth was more than 2 times higher in kids that didn't play sports than the ones that did. So this is also supported by a study that was done in Wisconsin around fall high school sports by the University of Wisconsin. I imagine you've all seen the study, and if not, we can attach that. They also found that kids that played sports got COVID significantly less than those that did not play sports. So in fact, the MDH has no data showing that COVID is transmitted while playing or practicing sports, and has been provided the data also by the Minnesota Hockey Association showing zero instances of opposing teams getting COVID after playing a team that later tested positive. So again, this is where you hear about all these quarantine issues, all these things where they talk about the threshold and do they meet the threshold? A kid could hop on the ice for under 24 seconds and then knock out a whole team. And that's, to me, and to all of you, is not following science. So just recently, the most appalling and the most disturbing thing that we found is that there's been several internal Minnesota Department of Health emails showing that Governor Walz, Commissioner Malcolm, and other political consultants had, in their own words, they wanted to tie youth sports to the spread and deaths in long-term care facilities and nursing homes. So there is absolutely no evidence for this, but the governor was worried that nursing home deaths were increasing, and he wanted to blame kids instead of accepting his own responsibility. And on a personal note, we have a family member that's in long-term care, assisted living, and some of our children have not even been allowed to go in. None of our children have been allowed to go in to see her since last November. Across the entire state, youth have not been allowed to go into any long-term care, assisted living facilities at all to keep them safe. So that's so hard to fathom. So let them play. Minnesota's advocating constantly. We're educating the public to eliminate unfair restrictions on our kids' activities and ensure that this type of political calculation is never, ever used again. Sports and activities are critical for our kids' development, their physical and mental health. Again, look at stats in Minnesota across the nation on mental health issues that are happening with kids and adults, but kids especially that have not had community, that have not been in school, and also just, the impact with suicide rate, anxiety, and depression. So Minnesota kids have been forced to carry too much of a heavy burden over the last year. And of course, we're happy. Let Them Play is happy that the pressure that we've been putting on the state has led to recent relaxation around the masks outdoors. But again, Mr. Chairman brought up a great point. You still will have some teams and some facilities and different people that all have their opinion and interpretation of things. So we would like some consistency and some release and some freedom for parents to make that decision, as we do when we sign every waiver, when we write every check to sign our child up for marching band, be it any kind of sport that we want to put them in. We assume all risk and responsibility. It's not on the state, it's not on the facility, it's on us as parents, and we want those rights back. So it's clear that the biases and false assumptions drove a pause on youth sports and later the masking of kids while playing sports. You've all seen the videos from this winter and now into the springtime. There's mask-related injuries, FDAs, they've turned them into the FDA. Also to you probably have hundreds of emails and videos. How is MDH requiring a downhill skier to wear a mask while skiing? There's no science or common sense that would cause such a mandate. And we cannot continue to ask our kids to participate in the theater that some adults so they can feel good about seeing kids in masks. Each and every decision by the MDH and Governor Walz should be justified by data, science, and logic. We've been asked since last March to follow the science. I'm asking the governor and Commissioner Malcolm right now, follow the science. Look at the new MIT study. That is not new science, it's old science. That works. Masking anyone outdoors is absolutely asinine. Our government should not restrict our kids' freedom. It's causing harm to their well-being without factual basis and it should never be based on political motives. Kids cannot be used as political pawns. Let Them Play Minnesota will continue to work in a bipartisan way to promote the mental health, physical health of Minnesota kids. Kids need to play. They are a gift and not a danger, and they need leaders right now who will look out for their well-being. We ask all members of this committee to work together to ensure that this will never happen again. And we at Let Them Play Minnesota are willing to hop in on any meeting, help out any way we can to ensure that that will happen in the future. Thanks so much.
Thank you, Ms. Gilliam. Thank you. Next up, Bob Kaufman, then Carson Diekman, and then Katie. I'm sorry, I'll just leave it at Katie from Medina High School girls soccer. All right, so Mr. Kaufman, welcome to the committee. Please state your name and who you're with for the record. You may 5 minutes. Reminder: 5 minutes, everybody. I forgot to turn the timer on for Tom, so think it over.
I have to talk fast. Thank you, Mr. Chairman, and thank you, committee, for having me. My name is Bob Kaufman. I'm a parent of one of the players on the Hill Murray hockey team that you might have seen in the news was not allowed to play in the high school hockey tournament here recently. You've heard from Senator Housley and Mrs. Gilman about some of the challenges we've faced as a community and society. I'm going to share with you a personal story that hopefully resonates with you about the absurdity of some of the things that have been going on and the effect on our kids. Just a quick timeline of events as I get started. My son's hockey team qualified for the Minnesota State High School Hockey Tournament by defeating White Bear Lake on Wednesday, March 24th. On Sunday, roughly 5 days later, my son received a text that supposedly there was a player on White Bear Lake that had a COVID test on Friday, March 26th, and received the results on Sunday, March 28th, and that the result of that test was positive. On March 29th, the majority of the parents from the team met with Hill Murray administration. We learned that the athletic director from White Bear Lake High School contacted the athletic director at Hill Murray, the Minnesota State High School League, and the Minnesota Department of Health about this supposed positive test. The Minnesota State High School League informed our athletic director that our team would not be able to play in the game scheduled for Wednesday morning, March 31 at 11 o'clock versus Wayzata, as the game was scheduled 10 hours before a quarantine were to end. Hill Murray administration pushed hard to challenge this decision. Their view was this was not considered a high-risk exposure, and the kids would be able to go to school that day and should be able to participate in extracurricular activities. Despite this disagreement as to whether this was even a high-risk exposure in the first place, Hill Murray administration contacted the team that they were scheduled to play, Wayzata, and requested the game to be moved to Thursday, the day the Minnesota Department of Health said Hill Murray could participate. Wayzata was supportive and willing to move the game to Thursday. However, the Minnesota State High School League still said no, as they were not willing to make any changes to the schedule. As a result of all of this, the seniors on the high school team, 18 years old, 9 of them, filed a lawsuit in Washington County in an attempt to stop the Minnesota State High School League from forcing them not to play. The lawsuit included an affidavit from Neil Broughton, who said despite winning a national college championship, beating Russia as part of the Olympic team in the 1980 gold medal run, or many years in the NHL, his most memorable hockey experience in his career was the Minnesota State Hockey Tournament. It also included an affidavit from an NHL scout that talked about the importance of this tournament when they draft players. Specifically, those who play in this tournament are likely to get drafted higher and therefore earn a higher income throughout their career. The lawsuit was not even considered, as the judge that was assigned the case on Tuesday, March 30th, opined that the case should have been filed in Ramsey County or Hennepin County, which is fundamentally wrong as the plaintiffs resided in Washington County, so there is jurisdiction there. To this day, this entire situation makes my stomach hurt. In no particular order, let me share a few additional items. First, the Minnesota State High School League never had a history of informing schools when they can participate in activities and when they could not. Those decisions have generally been left to the discretion of each school for many, many months. Hill Murray, in fact, itself had proactively shut down teams many times based on contact tracing with no involvement from the Minnesota State High School League. It was the school administration that always had determined whether there was high-risk exposure and made that decision on their own, whether they should quarantine or not. In this case, for some crazy reason, the Minnesota State High School League stepped in. Worse yet, even though decisions has always been left to the schools in the past, to this day, we don't know who the decision maker was. The Minnesota State High School League said they made their decision based on what the Minnesota Department of Health required. Yet, the Minnesota Department of Health says they only give guidance, and the ultimate decisions are left to the Minnesota State High School League. A lot of finger pointing going on here. Hill Murray made a decision early on to prioritize kids and had their kids in school for the past 8 months. In doing so, they've had a lot of situations where they had to look at fact and circumstances, whether it was in school or in sporting events, and decide whether there was a positive exposure and therefore quarantine kids. Again, in this case, for some reason, they didn't have the authority to do that. It's unthinkable that the state government and the Minnesota Department of Health allow kids to be in the school that day, but yet they're not able to play a hockey game. To emphasize the point here, we should analyze the video from the game on Wednesday, March 24th, where the supposed contact occurred. They determined that no one player was on the ice with the other player with the positive test for more than 1 minute and 18 seconds. More importantly, close contact between any player and that one player did not occur for more than 4 seconds. All this gets,
Mr. Kaufman?
yes.
Sorry, you're going to have to wrap up. I don't mean to be rude.
Okay,
but if you
fair
wrap
enough.
up.
Yep, one last comment. It even gets more absurd, as you might have heard, when the Minnesota State High School League would not allow the team to play on Thursday, when no other changes to the schedule would be made. There was no other boys games that day, and it wouldn't have affected anything else. In closing, I will tell you that no players, of course, ever received COVID from this supposed contact. I will note that the Hail Mary team also offered to have every kid tested the morning of the game to make sure there was no positive cases. And again, that was not allowed. I would just tell you that I'm here today because I don't want to see another kid ever affected by something like this. This has been my son and many other players' lifelong dream since they were 2 years old. And to have it ripped from them is quite honestly unacceptable. And somebody needs to be held accountable. Thank you for your time.
Thank you, Mr. Kaufman. Next is Carson Diekman, then Katie, and in the hole is Sam Deal. So Carson, Katie, Mr. Deal, and then we'll go to the commissioner. So there you go. So Carson Diekman, welcome to the committee. Please state your name and who you're with for the record. You may begin. Thank you.
Hello, my name is Carson Dykeman. I'm a senior at Mankato West High School. I've been a swimmer since I was 9 years old, and I swam for Mankato West through high school and this past season that ended in March. I was pleased to be elected a captain of this year's team. Since the beginning of COVID, I have not known any swimmer that has contracted COVID at a swim practice or at a swim meet. I am friends with members of the Mankato West girls swim team who swam in that fall. Even though no one of them have gotten COVID from swimming, the girls' season was cut short, and the state high school league did not allow the girls to hold a state swim meet. I trained throughout the year, both for high school swimming, and I work toward competing internationally in triathlons. In late November, I was surprised when pools, gyms, and sports activities were unexpectedly closed by the governor. With schools closed and without sports, kids my age had nothing to do other than hang out with friends. I'm not an expert, but it seems like a group of kids swimming at practice is much likely to spread COVID than a group of kids playing Xbox in a basement together. I was glad when we finally were allowed to swim again in January, and Mankato West boys swim season had begun about 6 weeks late. I had a good season and was grateful to have the seed times to qualify for the state championship swim meet scheduled for March 20th. Then, less than 2 weeks before the state meet, I was informed that on March 9th, I was in a classroom with another student who had later tested positive for COVID-19. I was never told who the student was, but I had worn a mask in all my classes, and I always maintained my 6 feet of distance. Nonetheless, Mankato West administrators told me that I was required to quarantine for 14 days based on the quarantine rules imposed by the governor executive order, the Minnesota Department of Health, and the Minnesota State High School League. During my quarantine, I took 2 COVID tests and both times tested negative. My parents and I tried to explain that there's no risk to others because I did not have COVID and because I would be swimming through chlorine separated from others. Even though I tested negative for COVID twice, even though I would always be swimming in chlorinated water, even though my sport is and has always been separated and distanced, I was not allowed to swim in the state championship meet that I would have qualified, that I would have been the last swim of my high school career, because on the 11th day of my quarantine period. Meanwhile, on March 14th, 3 days before the Minnesota State High School swim meet, the date I was not allowed to swim on quarantine day 11, Governor Walz had decided to quarantine because of an exposure, just like mine. But the governor chose to quarantine for only 10 days. He had applied the same rules to me as he applied to himself. I could have swam in the state meet. This was not fair. To be clear, I will be fine. I am blessed to have the opportunity to participate in sports in the future, but that's not true for many kids who were subjected to quarantine rules and shutdowns not applied to adults or the governor. I ask members of the committee to find ways to look out for kids and not to allow our state government and state leaders to single out the youth people for unfair treatment. Thank you for the chance to speak with you today.
Thank you, Mr. Dykeman. So next up, we have Katie. Welcome to the committee. Please state your name and who you're with for the record. You may begin.
Thank you. My name is Katie Offit, and I am the head girls soccer coach at Edina High School. I am here speaking on behalf of a large group of coaches that created a proposal for a fall state soccer tournament and the inconsistencies we saw throughout the course of the fall. On October 8th of 2020, we sent a proposal to the State High School League that contained the following. In Minnesota this fall, an estimated 4,500 varsity athletes played close to 3,000 games without incident, and which does not take into account the thousands of additional games played at the junior varsity, sophomore, and freshman level. Our proposal asked for only an additional 28 games in total to be played across girls and boys, AA and single A level. Within that protocol, or within the proposal, we discussed the venue protocols that had already been in place the entire fall. Part of our proposal included the permission of 4 high schools to host all levels for boys and girls. And those hosts included Stillwater, Edina, Hill Murray, and Blake. Within those venues, the protocol that had been in place all fall and would have continued through the state tournament included all outdoor seating, following the MDH guidance of no greater than 25% of the capacity. There would be advanced ticket sales, which had been working all fall. They would ensure proper social distancing. There would be no concessions as to promote grouping within parents at halftime. There would be 30 minutes in between each game to allow for proper clearance and cleaning of each venue following the prior game. No benches on the field. All chairs would be 6 feet apart on the sidelines for players and coaches. Teams would be placed on opposite sides of the field to allow for ample social distancing. There would also be mask wearing on all benches, followed by all coaches and administrators on the field. Along with that venue protocol, the logistics for the host schools would also include 1 site manager per site provided by host school. Any volunteers needed, the host site would provide. No programs, trophies, medals, no ceremonies. This was simply about playing the game. No third place game, and they would charge $10 to $15 per ticket to cover the costs. For the athletes and staff, athletes would wear masks at all times except when playing in the game. This includes the entire time on the sideline, any conversations with coaches, warming up, etc. Coaches and host site personnel would also be mandated to wear masks at all times. Referees would also wear masks at all times except during the games themselves. And part of the issues that we knew would be presented would be travel. If an outstate team advanced to the state tournament, a school located at or near the geographic midpoint between schools would be recruited to host the game, which would minimize long travel times and obviate the need for overnight stays in a hotel. For example, if Duluth East makes the tournament and draws Wayzata, the game would be played in a central location and it would continue to do so as long as Duluth East continued to win. Again, we had 4 host sites that were confirmed and that all volunteered their time, their effort, and their staff. The State High School League came back to us and said, at this time, our board has made the decision to maintain a focus on a postseason that is based locally, concludes at the section level, and is in alignment with the recommendation of the MDH to reduce the gathering of individuals, especially from a variety of communities. In addition, the board has recognized the importance of both demonstrating consistency of application of its decisions and continuing to look forward to greater opportunities. The piece that we struggled with was the word consistency. They discuss the need to stay away from any sort of travel and remain local, but yet it took 30 seconds to see within section games alone, only on the girls' side, we didn't even need to dig into the boys' side, that Bemidji traveled to Alexandria to play a game. That is 128 miles. Brainerd traveled to Maple Grove, also 120 miles. Albert Lee traveled to play Waconia, 110 miles. Brainerd traveled to play Moorhead, 137 miles. So we struggled with the consistency, saying that the tournament needed to stay local, but yet within the section tournament itself, we had a monster amount of travel. It was a tough pill to swallow to explain to the seniors the decision behind no state tournament when we had been following the protocol all fall. And within my program alone, we had almost 100 athletes and we had 0 positive cases. We didn't even have anyone in quarantine for the entire 10-week season. So again, to have to explain to my seniors that many of them will ended their career in the section tournament, that there will be no state tournament, and to not be able to explain the inconsistencies that were part of the ruling. Thank you.
Thank you very much. So now we go on to Mr. Deal, then Commissioner Malcolm, and then Executive Director Martins. So Mr. Deal, Commissioner Malcolm, and then Martin. So Mr. Deal, welcome to the committee. Please state your name and who you're with for the record. You may begin. Thank you.
Thank you, Mr. Chairman and members of the committee for allowing me to testify. My name is Sam Deal. I'm a parent of youth athletes, and I'm also the founder of the Cross Castle Law Firm. I've been working to help young people treated unfairly because of COVID-19 since I sued the Minnesota State High School League on behalf of kids last September. Let Them Play has now obtained over 8,000 pages of documents related to the Minnesota Department of Health and Governor Walz's statements and decisions regarding youth sports last year. These documents provide a deeply troubling picture of decisions and decision-making regarding youth sports. At the outset of COVID, it appears that the Department of Health attempted to genuinely look for the sources of the spread of COVID. However, by October 2020, MDH staff were overwhelmed as cases increased all across ages and demographics. Despite promising to control the virus with the turn of a dial last spring, by fall, Governor Walz and MDH had made little progress at understanding or be able to control the spread of COVID-19. After reviewing a summary of activities that MDH believed caused the spread of COVID on October 22nd, Governor Walz's chief of staff concluded, quote, "Given these numbers are small in comparison to the overall case numbers, I assume the conclusion here is that we just don't know where most of the transmission is happening," end quote. Rather than admit MDH's failure to determine the source of the spread of COVID, Commissioner Malcolm asked Chris Erzman to, quote, "think creatively," end quote, about ways to make certain areas that MDH assumed to be more dangerous to appear more dangerous based on the rhetoric and language used by MDH. Like certain other disfavored activities, such as health clubs and restaurants, MDH applied a definition of outbreak to youth sports that was designed to increase cases, but that Minnesota's deputy state epidemiologist has now admitted in sworn testimony was not scientifically valid. At the same time, MDH intentionally avoided collecting potentially inconvenient data. For example, Governor Walz repeated statements such as, quote, "We're not seeing the massive spread in retail settings," end quote. While this sounded reassuring to the public, it only meant that MDH had intentionally avoided collecting any data regarding spread among retail customers. Lacking data, MDH began to make youth sports sound dangerous through misleading terminology. Commissioner Malcolm and Chris Erzman discussed cases and outbreaks allegedly related to youth sports. Privately, MDH epidemiologists who had attempted to collect that data admitted that they did not know if transmission had actually occurred during any practices or games. In other words, MDH had no idea if playing sports created a higher risk of transmitting COVID at all. Had they looked into the data, Governor Walz, Commissioner Malcolm, and MDH could have easily discovered that their own data showed that kids are less likely to spread COVID than adults, and kids who play sports are significantly less likely to spread COVID than kids who don't play sports. MDH had never attempted to estimate the number of kids who play sports or engage in similar activities, approximately half of Minnesota young people. That analysis and that estimate would have demonstrated that MDH's numbers allegedly related to sports were small and insignificant compared to the overall number of cases among young people. To his credit, Tarek Tomes appears to be the only member of the Walz administration to push for a realistic assessment of the dangers of sports. But comments about the number of kids who play sports or assessing the number of cases in relation to the number of participants in sports were disregarded by epidemiologists, including Chris Erzman. Those epidemiologists never compared the number of COVID cases among kids who play sports to the number of COVID cases among all kids. Had they done that, they would have realized that the number of cases among athletes was lower and insignificant compared to the overall number of cases. MDH never seems to have realized that sports are by definition healthy, supervised, and naturally distanced activities. Instead, MDH trotted out charts showing that COVID cases among athletes and attendees at sporting events increased. But these increases were never compared to the increases among all kids, which were far more significant. In fact, more than twice as the rate of increase among all kids was more than twice as high than the rate of increase in cases last fall among athletes. By November, Governor Walz and other leaders had a political need to show that they could control COVID and turn dials. They faced public criticisms regarding school closings and regarding deaths in nursing homes and long-term care. It was clear, however, that because the cases among all kids were higher, youth sports could not have been the cause of the spread and school closings among other kids. And meanwhile, MDH had no data linking long-term care to youth sports. In fact, on November 16th, just 2 days before the governor shut down youth sports through Executive Order 2099, an epidemiologist privately admitted or was asked a question by email about, quote, the largest 3 to 5 drivers of spread in youth sports, end quote, in order to determine what a facility should do in terms of its protocols. In response, the epidemiologist admitted, quote, you raise an interesting question. What data do we have to support youth sports transmission? At this point, there isn't much.
Mr. Deal, I appreciate the testimony. You're gonna have to wrap up though, okay?
I will. I just want to share quickly then a couple of emails on this subject. This is a November 18th email from a consultant to the governor, to communication staff at the Department of Health, and to Governor Walz administration. I've highlighted a couple of parts of this email that indicate a political strategy by the governor to tie youth sports to long-term care deaths. And
Mr. Chair, this is ridiculous and outrageous that he's litigating this in front of our committee, making tons of claims that are unsubstantiated like they're fact. I find that to be abhorrent.
So Senator Isaacson, he's wrapping up and the commissioner is next. Commissioner is going to have the floor for ample time to discuss this. He's a citizen representing citizens. It's testimony. He's not litigating anything. It's not any different than anybody has presented in front of a committee ever in the past. Commissioner's up next and he'll wrap up in a minute. Mr. Deal.
Thank you. This is a second email that I have added highlighting to, but is an original copy of an email from Deputy Commissioner Kelly to Chris Erzman, Dan Huff, and others at the Department of Health, indicating that the governor and the First Lady are looking to communicate data regarding youth sports and connecting that to long-term care facilities. If you continue up the chain and see the responses, it's clear from a response from other leaders that there is no data that supported this already, and that this is a communication strategy and not based on the Department of Health's data. Just
Mr. Deal, I do have to ask you to summarize your comments as we move on.
To conclude, MDH's contact tracing and outbreak data shows that long-term care caused cases in sports, but there is no indication that sports caused any cases among long-term care. Both the Minnesota Department of Health and the Minnesota State High School League have unfairly quarantined and canceled youth sports, not based on data, but based on wrong assumptions and based on political considerations that should not be applied to our kids and to youth sports. Thank you, members of the committee.
Thank you, Mr. Deal. You unshare your screen there. Thank you. So now we have Commissioner Malcolm. There she is. Welcome to Commissioner. Please state your name, you know how it goes. Please state your name and who you're with for the record, and you may proceed. Thank you.
Good morning, Mr. Chairman and members. Thank you for this opportunity. I'm Jan.
I'm sorry, Commissioner, just so you know, all members have this PowerPoint in you're sent this PowerPoint electronically. You should have it. Thank you. I'm sorry, Commissioner, go ahead.
Thank you, Mr. Chairman. Jan Malcolm, Commissioner of the Minnesota Department of Health. Appreciate the chance to appear before you this morning. I just want to acknowledge before starting on the slides that the previous testifiers have made a number of important points and have a number of assertions. And I very much like to follow up in writing after the hearing to correct the record on some points and to try to respond to some of the questions asked.
Thank you, Commissioner.
Thank you. So I'll very quickly go through these slides. The core point here, I think, is what we're talking about is our best attempt to keep kids safe, to prioritize in-person learning, and to prevent problems from happening. There's always a problem with prevention, that you can never prove that because something didn't happen, it was because of the preventive actions that were taken. But I'm certainly more than happy to try to explain to you the basis on which we set our recommendations, our policies, what information we relied on, and I'm sure we will get into that dialogue in the questions. The next slide shows what has happened to cases. If you'd advance the next slide, please. What is happening to the case trends among students and staff in education. I'm not sure who's sharing the slides. I think one of my colleagues is trying to. There might be a problem with advancing the slides. So we'll keep working on that. So the cases among students and staff has generally tracked the epidemiologic curve of the epidemic in Minnesota over time, but we definitely have seen an uptick in student cases, and we think that has a significant amount to do with the variants that are now beginning to spread more widely. If you're having any luck with the slides, apparently.
I think
sorry, is it still not working, Commissioner? I don't know.
Okay, our apologies, Mr. Chair. I think members do have.
I think Commissioner, it's showing. I have the TV screen on as well, and it appears to be showing. So I don't know what the issue is.
It's showing without it being actually like loaded. It's showing it in edit mode.
Okay, let me try one more time.
There, I at least saw something move. Our apologies to the committee. Okay, hopefully we're good now. So this is a picture of the cases in early childhood through grade 12 staff and students. This is both the students who were infectious while they were in school and those who were not in school, either in distance learning or quarantine. But you can see there the slope of the curve over time, and more recently, since the beginning of this year, the significant increase again in cases among students. The relative stability in cases among teachers and staff reflects the impact of immunizations, which of course is a very good thing. Next slide, please. I'm particularly interested in tracking here is and seeing that in the more recent wave of case growth, we've seen a definite shift in the epidemiology that younger aged kids and their parents have really led the way in this latest surge. And you can see there the test positivity rate and how that increases week over week since late February. And the first group to show a sizable jump was the 10 to 19-year-olds. I think everybody knows at this point about test positivity. That's the percentage of tests that come back positive. We consider anything over 5% to be cautionary in terms of that representing a lot of viral activity in the community. And you can just see there kind of the progression in positivity across the different age bands. And really the only groups that haven't increased quite substantially are elders in long-term care, again, reflecting the success of immunizations in that population. Next slide, please. This is a chart of the outbreaks. So this is not a count of cases, but of actually the outbreaks. It was mentioned before that the definition of outbreaks that we use is that there are 2 cases in the same team, at least 2 cases in the same team from different households that occurred during an incubation period during 14 days. So that's how we categorize it. Again, this just is counting the number of outbreaks, not the number of cases associated with them. And you can see there the decline during during the pause in the late fall, and another decline during kind of the transition between the seasons, and now unfortunately the increase that we've been seeing, again, we think significantly due to the variants. Next slide, please. So we now, as you may know from various news reports and our frequent briefings, the variant known as B.1.1.7 that was first discovered in the United Kingdom is we think now accounts for about 60% of the case spread that we've been seeing lately. That's based on genomic sequencing of samples of positive cases. What's different about B.1.1.7 is it's significantly more transmissible. It has a much higher attack rate, meaning that if you have a group of 10 people in an exposure situation, maybe 1 or 2 or 3 of that 10 would have contracted COVID from the original strains of the virus. And now with B.1.1.7, it's more like 8 or 9 or all 10 are being exposed from the same type of situation. And with this, we just have not seen this degree of spread in previous spikes. And because of the high attack rate that and the way that this spreads between members of a family and the potential to spread to other sectors, including the ability to spread from the family to another setting, be that child care or long-term care or any other workforces. And besides being clearly more transmissible, evidence is getting stronger that B.1.1.7 accounts for more severe illness as well. And of course, just part of why this is so hard to control at just an individual community or frankly an individual state level is just the degree of interconnectedness among us and interconnectedness of activities. Next one, please. And certainly, I'm sure the committee is aware that this is not just an issue here in Minnesota, not just something that the Minnesota Department of Health is focused on, but indeed, this is something that's been of significant concern to the CDC. We've seen in other states similar conclusions being reached about the relevance of activities among younger people to the spread. And you just see some of the recent headlines on that score. And we've all been watching Michigan as really the kind of the bellwether. Like us, they have a lot of B117, and we've been watching, kind of how our case trends compare to theirs. Next slide, please. Most recently, they've seen a record high level of hospitalizations for children. The United Kingdom has been publishing more research too on the increased severity, including increased severity in kids, where happily we've seen less severe disease in prior waves, but that appears to be changing with the new variants as well. Next one, please. So in terms of the sports guidance, we have made some changes in the health guidance for spring sports, particularly with respect to outdoor masking. Last week, we did say while we still do encourage masking, it is an extra level of protection. Participants in outdoor sports do not any longer are not required to mask during competition or practice. Our guidance says masking still should be required while participants are not actively playing or practicing. And this applies only to outdoor sports. There is no change in the health guidance with respect to indoor sports, that face coverings still are required due to the higher risks indoors. Next slide, please. And partly what we are also trying to do in an attempt to help actually protect athletes, to keep them able to be playing and to keep kids able to be learning in person, we want to just further encourage frequent testing. And we've suggested that all teams are really encouraged strongly to test every week, especially if they choose not to mask. And this is not just about the athletes, but the coaches, staff, volunteers, and others. And with a very important point here that those who are vaccinated do not need to test. So we're looking forward to the expansion of age eligibility in the future, but 16 and 17-year-olds, as you know, are eligible to receive the Pfizer vaccine now. So we want to encourage that as another good way to protect the ability of kids to participate in these activities. And we've got, as you know, a lot of options for how to get tested in Minnesota, and including that making free test kits available to teams at school or to parents and families at home or through their participating sports clubs. So we're doing what we can to make those resources easily available as another good way of actually protecting these activities, which we completely agree are important to kids. Next slide, please. And again, with respect to vaccination, we really would love to see a close partnership with schools and teams to encourage this as a great way to protect the kids, protect the activities, both with respect to the important health benefits, but from the perspective of what we're talking about a lot here, if someone is fully vaccinated and exposed, they don't need to quarantine as long as a couple conditions apply with respect to when they were vaccinated and if they are fully immune. And of course, if they don't have symptoms of COVID-19 themselves. Next one, please. So one question that's been is whether the exposure assessment is different for spring sports than winter sports. And yes, it is. Since most spring sports are played outdoors, and we know that outdoor settings are less risky. We know that many of those spring sports inherently have more distance among players and less close contact. The quarantine assessments, the guidance is different from winter sports, such that that would result in fewer recommendations for quarantine after playing or exposure, playing with someone who's had a COVID case. Next slide, please. So questions have also been raised about, well, how does this work? What's the role of the various parties here? The health department and the Department of Education rely on our key partners like the State High School League and on schools to consider and carry out the guidance that we publish. The published health guidance is part of the Safe Learning Plan. Safe Learning Plan references that guidance. And the whole point of which is to keep kids safe, protect in-person learning, and also to protect these activities. So that the Stay Safe guidance sets those baseline requirements, but teams and leagues do have a role to play in some of the decision-making. What our role at MDH is to promulgate this guidance, to communicate where there are potential transmission risks in sports activities, just inherent in the nature of sport, and the activities that come along with sports are some of the things that create transmission risk. Proximity over time, engaged in activities that have of exertion and healthier and heavier breathing, given the role of airborne transmission, particularly indoors. That's what kind of leads to this concern to begin with, leads to the CDC quarantine guidance, which is what our guidance is based on, is just the risk of transmission in these environments. So it isn't always only about, knowing that you've had a case. It's about the transmission risks in the environment that are just inherent in that environment. So we communicate that potential transmission risk. We provide assistance to partners and organizations on their prevention plans, ways to limit the risk of spread, and when asked, to provide the exposure assessment to a potential situation and to advise on contact tracing, quarantine, and isolation guidance. The teams themselves are responsible to have preparedness plans, including ways to mitigate the risk of disease. They're required to report cases. They're required to conduct contact tracing and exposure notification, and to oversee the adherence to the isolation and quarantine guidance. The guidance provides a framework for those decisions and allows teams to consider the shortened options for quarantine based on those criteria of testing and negative tests and lengths of time. And the safe learning plan from the Department of Education is where those standardized quarantine requirements are embedded, and schools are required to follow them. But the State High School League works to help enforce the learning plan requirements when it comes to sports.
Commissioner, we got about a minute left. We had to move on. So
yes, sir. Just wrapping up.
I ask you to wrap up, and I do have one question for you when you're finished.
Certainly. Next slide, please. Just to end on the point that we all really have a role to play, and this is much more of a shared goal than some of the statements might suggest, that we do appreciate the important role of these activities and are doing everything we can to try to keep these activities safe and to maximize the chances through testing and through adherence to the guidance and now through vaccination to keep these activities safe. Thank you, Mr. Chair.
Thank you, Commissioner. I do have one question for concise answers we can get. So in all this stuff, I just want to confirm maybe I missed it somewhere in your PowerPoint. Were you able to get to the point where you could directly connect the transmission to the athletes on the field or on the rink or on the court or in the pool, as opposed to non-athletes or other socialized? In other words, if that makes sense, were the athletes or were the transmissions from the athletes as opposed to somewhere? Were you able to get down to that level and determine that it was the athletes transmitting the COVID-19, or was it someone else, non-athletes and other social events? Were you able to do that?
Thank you, Mr. Chair. We have had a couple of deeper investigations that we believe were pretty conclusive in terms of the spread happening during the play or during the practice. But in addition, we also look to published data from the CDC and others about the documentation of actual of transmission between participants. It is not every case obviously can be investigated to that level or researched to that level. So again, kind of the core premise here and the CDC guidance is based upon just the fact that sports activities fit the profile of what is heightened risk for transmission, just given what we know about this virus.
Mr. Chair, to that point,
yeah, Senator Housen.
Thank you, Mr. Chair, and I'll be brief. So I'm just, Commissioner Malcolm, so did you do a study that we can see numbers like they did in Wisconsin, where they actually showed that student athletes contracted the virus and spread the virus even less than those who weren't athletes? Do you have those numbers that we could see?
Mr. Chair and Senator Housley, no, I'm not aware that we have any data that suggests that. I will certainly verify that, but my understanding is we have no such data.
Thank you.
Thank you. Thank you, Senator Housley. All right, thank you, Commissioner, for your time and your testimony. Appreciate it. Now we're going to go to the High School League Executive Director, Eric Martins. And Mr. Martins, welcome to the committee. Please state your name and who you're with for the record, and you may begin. Thank you.
Thank you, Mr. Chairman and members of the committee. Eric Martins, Executive Director here at the Minnesota State High School League. And I too would like to use a PowerPoint to kind of guide that. I'm going to try to navigate myself if I can make that happen. And so hopefully with this, you will be able to see a picture there, and it is in edit mode, and just is much easier to be able to share as we go forward. So certainly the pandemic has created challenges for our students, for our schools, and for the league on many different fronts. And it's been an incredible experience to work our way through that. And just know that the timeline has been quite interesting as we've navigated through canceled tournaments in the winter a year ago, through the cancellation of spring seasons, into some practice in the summer, some seasons in the fall, and then working our way toward more full seasons into tournaments here in the winter. And with each one of those seasons has come number of changes of guidance, requirements, et cetera. And we have continued to navigate through that on a regular basis. We know, and earlier speakers certainly spoke to the value of the activities that we provide, the participation that our students have, and the experiences that they're able to have in athletics, in fine arts, and also in support of academics. And so those are critical and important as we go forward. In thinking about this particular year, our goal all the way through has been around safety for everyone involved with our activities, as well as a focus on reducing any impact on the educational model that exists within our schools. So I think it's really important for folks to understand who the Minnesota State High School League is and how it operates. Minnesota State High School League is different from many other activity providers in the fact that we are a set of member schools, 500 plus member schools that take part in activities and have come together and decided that we want to have a set of rules and consistency and guidance and governance over our activities in a way that is as safe and as consistent as it possibly can be. And so with our schools, we are represented on our board by 20 members, 4 of which are governor appointees, and the remainder of which are educators and or school board members at member schools. And so these are folks that are very connected and very involved with the school aspect of what happens. We know where our role is, and our role is built off of being able to provide the guidance and the governance for the activities that take place. We do have a sports medicine advisory that provides a fair amount of advice and direction to us, and has been critical in creating really safe experiences and even making national change in rules in sports, et cetera. But within the state of Minnesota, we know that the governor's executive orders, the Department of Health, and especially also our Department of Education impact the high school league significantly because we are a group of member schools. And so that is important to recognize as we go forward, that our work and our activities need to be in alignment with what's going on within our schools. And if you remember back to September, the rule was that if a school was in distance learning, then that meant that activities were also shut down. And so that's something that has evolved over time, and that has changed. As we think about what this is for the high school league, we have 48 different activities in athletics that take place. And the goal of our board throughout this pandemic was to try to provide some level of experience for everyone. We again recognize the value that's part of the Minnesota State High School League and the many activities which students participate in and have an opportunity to compete and enjoy camaraderie, work with their classmates, and do all of those kinds of things. Even so, throughout this year, as many know, we've had many creative approaches. We just finished a state speech meet with well over 300 members in each one of our classes that was completely virtual. They would have loved to be in the same place together competing, but that just isn't possible given the number of individuals that it has, the number of judges that need to come together, and all of those things. We've had situations where instead of prelims and finals, we've done time finals. We've shortened seasons, and we've worked to try to limit the number of contacts and contests and yet still provide a full experience for our students. We know how critical and how important that is to them. Our schools have been incredible in the way in which the school administrators, the health officials, and the coaches have put things in place to create safe experiences and to be able to continue forward to have those. We know that things like masking requirements, numbers of kids in a pod, the amount of time that they can be together or around one another, and the ways that they have to deal with things like positive cases and close contacts and quarantines are significant. Yet through that, our schools have persevered in being able to provide these seasons for everyone. As we walk through this, we know that throughout our year, interruptions have been constant. Again, like I said, county numbers at one time determined whether or not schools could be in person and whether or not they could have activities in session. And so we had interruptions that were built off of that. In the fall, as our board looked at how do we come out of a spring season that didn't happen and create something that is going to be as effective and safe as possible, they developed a plan that included section level tournaments only. We had a return to participation committee that was very involved in helping advise the board as well to say how far can this go. Unfortunately, in the fall, due to case numbers across the state rising, seasons were shut down early. And that's unfortunate. And that was part of a statewide pause in student or in youth sports. And so knowing that we did as much as we could do with what was available and work to try to provide that was important. Yet many teams and individuals in the fall also were impacted by the fact that either their school was not able to participate or they themselves were not able to due to either a positive case, a close contact, or a quarantine requirement. As we moved into winter, it didn't start until after January 4th, after we got through the holiday break. And building seasons there, we did have plans in place and said, if we're going to get tournaments, we've got to be planning on those kinds of situations now. We created state tournaments that had significant limitations and modifications. A great example is our dance tournament that took place at a high school instead of Target Center, where it usually is located. It was limited in number of fans to 250. And instead of every fan seeing every dance, we ran teams through 4 at a time. And we would then empty out the facility and we would start over again. And those kinds of models were used similarly in other tournaments as we work to try to stay in line with the guidance and the requirements on size of gathering and ways in which we can do this safely. As we went through the winter, teams and individuals did lose opportunities, and those are really, really difficult. The list that some of the folks that spoke earlier is an accurate list, and there are many more. Our board president, Blaine Novak, is a superintendent at New York Mills. His school was in a situation where their wrestling team had to be shut down right on the beginning of section tournaments. So their wrestlers not only lost out on maybe a state opportunity, but
Mr. Martins, you're gonna have to speed this up a tad.
Thank you very much. I will wrap up quickly. My point being that this was a pervasive situation and it was difficult, right? And as it went, the way that things operate is that as we looked at things from a league standpoint, it was important for us to have an interruption policy in place. And it was used in the fall, and it was even more formalized as we went through the winter. And this is just an example. But in essence, what it says is if a student individually or a team is not able to participate on the date and time at which it would be typically held and or scheduled, which our section and our state tournaments are all scheduled, unfortunately, they would not be able to compete and the other team would advance. And that was put in place in the postseason. During the regular season, because every school is able to set their own schedule, they could reevaluate and they could schedule at a later time. But within the season of, or the postseason timeframe, it was important that there was a plan and that it was clear and it was communicated with our schools ahead of time. And so our schools knew what this looked like and they were able to work their way through it. And I just want to remind folks that as I wrap up, the ways in which this operates is that the rules around close contact, positive case, and quarantine come from the Department of Health. And so when this happens in a school, they receive information regarding their students and what took place. They verify what those cases are. They then make identification of who constitutes a close contact, and they apply the appropriate quarantines. And those quarantines are defined by the Department of Health. And they can be at 14 days, 10 days, or 7 days. So the first day back to competition could either be day 8, day 11, or day 15, depending on how that is. The schools work with their incident command team as well as local public health folks and also the Department of Health when those happen to identify what those requirements might be. When a student or more than one student is quarantined, those quarantines apply to all aspects of school, including in-person learning, including participation in activities and athletics as well. And those are brought forward. And so our league has been supportive with our schools in addressing those quarantines and also being consistent in the application of what those look like in regards to competitions and how they might be able to advance. Our hope, like everyone's, is that this is something that looks very different as we're able to start next year, and that we're able to not have the level of interruptions, not have the infections, not have the close contacts, and all of those pieces that we have to work through. And so appreciate the time here this morning to try to make sure that folks understand where the high school league is and the roles in which we play as we build guidance and lead our schools through the remainder of this pandemic. Thank you.
Thank you, Mr. Martins. Very, I don't know how schools and athletes and parents are supposed to manage this with variety of decision-making sources and the constant changing of information and how it's supposed to be properly managed and effective and consistent and uniform. Anyway, we're going to have some quick final comments here. I'm going to let Senator Benson go, then Senator Isaacson, and Senator Weaver.
Mr. Chair, actually, mine was a question, but I'm happy to move to final comments as time is short. First of all, I have heard very directly from parents in schools and from people who run athletic programs that they will not move off of MDH guidance because of liability issues. They would like to move to the testing protocols that allow kids to go back at 8 days on day 8 and on day 11. But because this hard line has been drawn at 14 days, they're afraid that they would be held liable. So until MDH gives permission for other choices beyond just saying, oh, it's okay, and have that floating out there, I think all the athletic programs and schools and theater programs and choir programs are all stuck in the same spot, that we're going to quarantine kids for 14 days. And, you know, an entire track team was quarantined because one kid at the front of the bus on a 20-minute bus ride tested positive. Nobody else on the bus tested positive at either testing point, still quarantined for 14 days. And so that entire team was shut out from running. This is bothersome, intractable until MDH, and I have raised this numerous times with the Minnesota Department of Health. Give them guidelines that say if they are testing every week, they can move to this quarantining protocol. If you want people to test, give them a reason to do it. There are teams, I am sure, who'd say, you know what, every Tuesday, everybody tests, and we're going to move to a lower quarantine guideline, because it's about kids participating and being safe instead of just the safe, which seems to be the only conversation that happens anymore. Try not to get too upset. I have relied on the Minnesota Department of Health's data and experts for more than a year to help me make judgments about what policies should be coming out of the Senate and what to support and what to push back on. And then I see emails that say youth sports, and then the pause idea came up. The election, particularly the loss of DFL seats in the House, was in part due to our guidance. And then I see a messaging email that says, for some more messaging notes, we need to be more explicit, i.e. youth sports tied to long-term care. People are going to youth sports sitting in bleachers, eating popcorn and talking, cheering, and then popping into a restaurant, and then going to the jobs in long-term care. The spread and deaths in long-term care can be traced back to youth sports. That was a messaging email. I mean, it is shameful that the hard work of epidemiologists who have been doing everything they could to get the best information, and I trusted them. And now somebody in politics is saying, well, we need the message to be youth sports connected to the deaths in long-term care. Here's the way it should work. There is data, and then there's a decision, and then there's communication. Not, we need a message, go find me the data that matches it. This is embarrassing for a department that I have relied on and that I've worked side by side with. And I'm sorry, what data do we have to support evidence that youth sports is contributing to long-term care transmission? This is not the way it's supposed to work at all. We are in the middle of recovering from a pandemic. And now we're finding out that in November, there are deaths in long-term care, let's find somebody to blame and go get the data that supports it. This is the way it works. Data, decisions, communication.
Thank you, Senator.
Anything else is backwards. I'm sorry, Senator Chamberlain, your meeting, I will stop.
Thank you, Senator Benson. Thank you very much. So we're going to go to Senator Isaacson, then Uyghur, then Housley, and then I'll wrap up. And we got to be out of here in about 10 minutes. So, Senator Isaacson.
Thank you. Well, I hope Senator Benson's listening, and I look forward to her data-driven decisions on voter ID and climate change in the future. That'll be nice.
Let's keep it to what we got here, Senator Isaacson.
And so let's be clear about this, right? Is it tragic and unfortunate that COVID-19 pandemic has caused us to have situations where kids are not able to compete in their sports when it's their life in high school? 100%. 100%. I feel horrible about that. I feel the same angst that everybody else does, but let's be clear about where the responsibility lies, right? For example, as a parallel argument, I can't come to the Senate floor unless I'm willing to quarantine for 14 days after. Ask me why? Because my father-in-law's lung transplant doctor said, and I quote, as long as Republicans won't wear masks, you can't go to the floor. That was an actual quote from my doctor, unsolicited. So when we talk about things that are unfortunate, I understand that it is tough that kids aren't able to compete in their sports. But it's even tougher that I go 14 months without seeing my dad, or being able, which I was able to see this weekend, and now I'm quarantining for 14 days, who, by the way, is dying. Or it's tough when I watch my father-in-law, who had a lung transplant, have to be limited in how much family he can see because of this COVID crisis. So I hope we can keep this in perspective. People are dying. Okay, people are dying. Am I unhappy that there could have been inconsistency? Sure. Should we ask MDH to call that out? Absolutely. Does that rise to the level of several of the things we have going on in front of us that we need to manage? No. No, it doesn't. And Senator Housley, you can shake your head at me when you talk about the doctor, but that's what the doctor said, not what I said. The doctor said that. And that's a consistent problem on the floor. And so when I look at this bill or this language we're talking about and the frustration we have with MDH and the frustration we have with high school leave, yeah, it's complicated and it's hard. And there is no guidebook on this. But when I hear testifiers on here calling out the governor's intentions, trying to cast political aspersions, when I look at the timing of this committee, we want to talk about politics. The irony is not lost on me. I have no problem having a discussion holding MDH or the high school league accountable if they've made some mistakes and they haven't been fair to students. I get that. But to pretend like one kid on a bus getting COVID doesn't qualify for a quarantine, that's fake science. That doesn't even make sense. Just because it doesn't make you feel good. Yeah, it doesn't make me feel good either. But I want to see us be successful. And it's ridiculous that holding these kids in a spot where they're healthy is not as important letting them play. And the arguments I'm hearing today, it's disgusting. And I'm very disappointed.
We're going to go to Senator Uyghur, but look, everybody, senators, members, this has been brought to us by citizens. This has not been a partisan issue. Democrats have been contacted by their constituents. So it's not partisan. If you want to scream at somebody, you're screaming at citizens. We're having this hearing because a lot of frustrated citizens and people, parents and kids, are concerned about the inconsistencies between what they hear and see in reality. So if you want to yell at the people, you've done a good job, Senator Isaacson. Senator Uyghur, you're up. And then we'll go to Housley, Senator Housley.
Thank you, Mr. Chair. It's a bit ironic. The day started with a bipartisan meeting for those interested in promoting civility and what we can do to work more effectively together. And I thought, we're doing our best to get through a pandemic, which is clearly not over. Yes, I've heard from parents, there's frustration. All of us are at a higher level in terms of how we're dealing with this, but getting right back to where we're at now, the high school league has encouraged the use of masks. There's been guidance that's been given. I strongly believe that the Commissioner of Health's integrity is unimpeachable. And the accusations on the record, I find very offensive. And I've just seen the federal lawsuit. I believe it was filed Friday and a hearing right now. I see it wants to seek full damages, well, of course, for the attorney, but a number of things regarding the no more involvement by the Department of Health. The governor would no longer have a role as it relates to the high school league, to any additional orders that might be done. We are still trying to navigate through this pandemic. And if there have been mistakes made, then we can air it. But the issue of blaming the governor and saying that this is a part of manipulating data for long-term care, I believe is totally false and unfair. So let's continue to navigate through this together, but to hopefully have a civil discussion where we can talk about solutions. And we'll leave it at that because we're out of time.
So thank you, Senator Uyghur. Senator Housley, got a word or two, a minute or two?
Yeah, thank you, Mr. Chair, again for having this hearing. Like you said, this isn't coming from us. I don't have kids in sports anymore. I don't even have kids in high school anymore. This came to us from our constituents, and the turn it did take, which I didn't know, were those emails that I think is a whole nother hearing, maybe in Senator Benson's committee, because that is quite disturbing. The reason for this meeting and what the parents want to know is who is making these decisions? Where is the guidance coming from? Even in the Minnesota State High School League slides compared to the Department of Health slides, State High School League slide says that they provide recommendations, yet the Commissioner Malcolm slide, MDH is providing requirements according to Martin's slides, and MDH is saying they're just recommendations. So are these MDH requirements or are they just recommendations? Does the State High School League have the ability to make decisions apart from what MDH? And it seems to me there's conflicting stories there. Who actually is making that decision? Or is this coming from the governor, MDH, or the State High School League? That's what I think parents want to know. And they want to know going forward, because we've all just heard through this committee all of the inconsistencies. Wrestling teams don't have to wear masks, but Carson can't swim on day 11 of his quarantine of 14 days, yet he's tested twice negative, yet the governor comes out of his quarantine on day 10. What are the rules? People need to know going forward, what are the rules? And is there any room anywhere to make an exception for a state championship or a state tournament? Is there any room now that where we're at? And again, where is the science and data that supports student athletes are contributing to a greater cause than everybody else, and somebody playing Xbox and somebody going to a restaurant, or kids just in school? That's what I want to see. And that's what parents and our schools and our athletes want to see, that science and data. And I don't think it was presented here, Mr. Chair. But again, thank you so much for the hearing. I don't know if we got any answers, but thanks for letting the folks vent.
Thank you, Senator Housley. Thank you, members. Thank you, testifiers. Again, we're having this hearing because a lot of constituents talk to us. We represent the citizens of this state. You may agree or disagree with some of the issues. Maybe politics is always at play. We're here representing the citizens, the kids, the parents of this state to try to find answers. And I don't know that we found many answers today. What I have, my takeaway, and some of you are a little better at this than I am, is that it's unsure. I think parents and athletes are doing their best. The high school league is trying, but a lot of challenges remain and a lot of confusion. It's got to be cleared up. We need to serve the citizens better than this, especially the kids. So that's why we're having a hearing. And if things come out due to legal proceedings, that's how it goes. But we were here to try to get answers and try to kind of find clarity. I don't know that we found a whole lot of it today. It's very challenging, very confusing for us. I can't imagine what it is for the parents and the kids. So members, thank you for your time. Testifiers, thank you for your time and effort. Senator Housley, Senator Draheim, Senator Benson, thank you for joining us and sharing some thoughts. So with that, members, we are adjourned.